Hey everyone, welcome back to all my listeners. Today is Wednesday, January 10th, 2024. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. This is episode 2 in season 11. Now, let's dive in to today's episode. Today's Newsworthy features my OIG Work Plan updates for December 2023. And in my Trusty tip, I get into my compliance recommendations and what's new in prolonged service codes. And I'm going to go ahead and close out and round out today's episode with a remarkable quote on quality and quantity by Louis L'Amour. This episode is sponsored by Utilization Management University. Let's get into it. Whether you are involved in the business of healthcare or any other business, what do you, your teams, and your management concentrate on the most? Typically, they communicate, problem solve, and make strategic decisions that drive the success of the organization. But how much time is actually spent in making tomorrow better than today? Are they striving for operational excellence? Prevention versus correction is a concept that's been known for years. So why do so many companies not implement the process? Utilization Management University provides a course that proves to be a unique solution to instill change in the mindset of business teams. This course provides the theory and the practical approach. This course will demonstrate how to implement a simple methodology as a solution. This course provides a detailed explanation of each and every step involved in prioritizing your problems and finding the root cause. This course shows how to engage team buy-in. This course readily provides available support for any issues. And the course provides the theory and helps you adapt it to your own individual circumstances. Check out the details at www.utilizationmanagementuniversity.com today and get registered. Utilization Management University, making tomorrow better. So, let's get into Newsworthy. The month of December's OIG Work Plan updates. There are 6 updates to the OIG Work Plan for the month of December 2023. The first OIG Work Plan update for December 2023 is titled Audit of Medicare Payments for Emergency Department Services Provided in Non-Emergency Department Sites of Service. This final report is expected from the Office of Audit Services. An emergency department is defined as an organized hospital-based facility for the provision of unscheduled or episodic services to patients who present for immediate medical attention. Certain current procedural terminology, or CPT, and Healthcare Common Procedure Coding System, or HCPCS codes, should be used only if a Medicare enrollee is seen in the emergency department and the services described by the code's definitions are actually provided. Medicare reimburses providers based on the patient's documented service needs at the time of the visit and based on the site of service. This audit will determine whether Medicare appropriately paid hospitals and physicians for emergency department services provided in non-emergency department sites of service. This final report is expected in fiscal year 2024. Now, the second OIG Work Plan update for the month of December 2023 is titled Audits of Pharmacy Support for Prescription Drug Event Data. Now, this report is expected from the Office of Audit Services. Medicare Part D plan sponsors must submit prescription drug event, or PDE, records, which are summary records of pharmacy drug claims, for the Secretary of Health and Human Services to determine payments to the plans. For selected pharmacies, OIG will determine whether PDE records were adequately supported by inventory purchases and complied with applicable federal requirements. This final report is expected in fiscal year 2025. Now, the third OIG Work Plan update for the month of December 2023 is titled Audit of Tribal Controls over Indian Health Service Sanitation Facilities Construction Program Costs. Now, this report is expected from the Office of Audit Services. Under the Infrastructure Investment and Jobs Act, Congress allocated $3.5 billion to the Indian Health Service, or IHS, Sanitation Facilities Construction, or SFC program, to provide American Indian and Alaska Native homes and communities with essential water supply, sewage disposal, and solid waste disposal facilities. OIG plans to perform a series of audits that will examine internal controls in place over SFC program construction projects that are managed by an agreement between IHS and a tribe, or managed by a tribe that has assumed sole responsibility for a project. For each audit, OIG's objective will be to determine whether IHS area offices or tribes implemented internal controls for awarding, monitoring, and reporting SFC program projects according to applicable federal and tribal requirements. This final report is expected in fiscal year 2025. Now, the fourth OIG Work Plan update for the month of December 2023 is titled Audits of Strategic National Stockpile Sites. Now, this report is coming from the Office of Audit Services. The Strategic National Stockpile, or SNS, is a repository of medical countermeasures for use during public health emergencies. Prior OIG audits identified systemic issues that could place the SNS inventory at risk. In 2018, oversight of the SNS was transferred from the Centers for Disease Control, the CDC, and Prevention to the Administration for Strategic Preparedness and Response, the ASPR. Now, OIG plans to conduct a series of audits to determine whether ASPR established adequate controls for two things. For maintaining physical security over SNS sites, and two, records of inventory. Now, this final report is expected in fiscal year 2025. The fifth OIG Work Plan update for the month of December 2023 is titled Food and Drug Administration's Oversight of the Submission of Applicable Clinical Trial Results to clinicaltrials.gov. Now, this report is coming from the Office of Audit Services. The Food and Drug Administration, the FDA, is responsible for ensuring that results of applicable clinical trials are reported to clinicaltrials.gov within 1 year of the completion date. Clinical trials are vital to human medical advances because they help determine whether interventions are safe and effective, and it is essential to have transparency with the public about clinical trial results. The FDA monitors compliance with reporting requirements through various methods, including evidence collected during inspections conducted as part of the FDA's Bioresearch Monitoring Program. The FDA may notify a responsible party that has not met reporting requirements and allow 30 days to remedy the noncompliance. If a responsible party remains noncompliant, the FDA may initiate a corrective action, including seeking civil monetary penalties. The OIG will conduct an audit to determine whether the FDA notified responsible parties of noncompliance with the requirement to submit the results of applicable clinical trials in accordance with federal requirements. This final report is expected in fiscal year 2025. Now, the sixth and final OIG Work Plan update for the month of December 2023 is titled Medicare Payments for Home Dialysis Services. This report is coming from the Office of Audit Services. Medicare Part B covers outpatient dialysis services for enrollees diagnosed with end-stage renal disease, or ESRD. Treatments can be provided in an outpatient or home setting and must be monitored by certified ESRD facilities. Prior OIG work identified inappropriate Medicare payments for dialysis services. Specifically, the OIG identified claims for which there were neither dialysis treatment notes for home dialysis sessions nor documentation of the dispensing or administration of medication billed. Additionally, the OIG found claims with medication billed exceeding a physician-prescribed amount, as well as other issues with comprehensive assessments, plans of care, and physicians' monthly progress notes. The OIG will review claims for Medicare Part B home dialysis services provided to ESRD patients to determine whether such services complied with Medicare requirements. Also, OIG will review the impact of home dialysis services on enrollees and whether enrollees' quality of care could be affected. Now, this final report is expected in fiscal year 2024. And now, it's time for my best practice tips in Trusty Tip. The new prolonged service codes for E&M visits in the hospital, nursing facility, and home or residence settings, with our HCPCS codes G0316 through G0318, have new medically unlikely edits, or MUEs, for the codes effective on January 1st, 2024. That's right, just 10 days ago, these MUE edits became effective. Now, according to the practitioner MUE files, CMS will set an MUE for 4 for each of these codes. That's right, the MUEs are effective at 4. Now, the agency cites that clinical data as the rationale for these limits. What that means is the treating provider will be able to report 4 units of service, which amounts to 60 minutes of time past the threshold for the primary code. Now, CMS assigned each code an MUE adjudication indicator of 3 to the edits. So what that means is you can appeal MUE-based denials. However, be very mindful and remind your coding and care teams that the medical record, the chart, must clearly support the medical necessity of the extra time when you alert them to this update. And you should expect the appeals process to be particularly tough, right? Now, CMS sets a high bar for all MUE appeals. The CMS reviewer will check the records to determine if the provider or the supplier actually furnished units in excess of the MUEs, if the codes were used correctly, and whether the services were medically reasonable and necessary. And that can be found, as CMS explained, in an FAQ on MUEs. Now, in addition, CMS gives its reviewers the final say on time-based coding. Or, quote, our reviewers will use the medical record documentation to objectively determine the medical necessity of the visit and accuracy of the documentation of the time spent, whether documented via a start-stop time or documentation of total time, if time is relied upon to support the E&M visit, end quote. Now, CMS has not shared any details on the factors that go into the objective determination, but it's a safe bet, in my opinion, that an appeal will fail if the provider only documents the time and gives very minimal details on the work they actually performed. So therefore, my best practice recommendations are always to include the fine details, right, of what was done during the prolonged time. Because remember the definition of codes and understand them. For example, G0316 is defined as, quote, prolonged hospital inpatient or observation care, evaluation and management services beyond the total time for the primary service, when the primary service has been selected using time on the date of the primary service. Each additional 15 minutes by the physician or other qualified healthcare professional with or without direct patient contact. List separately in addition to CPT codes 99223, 99233, and 99236 for hospital inpatient or observation care evaluation and management services. Do not report G0316 on the same date of service as other prolonged services for evaluation and management, 99358, 99359, 99418, 99415, and 99416. Do not report G0316 for any time unit less than 15 minutes, end quote. And finally, I focus Season 11 Spark on quality versus quantity. I want this 11th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for better understanding of quality versus quantity. So, in this week's inspiring quote in Spark is from Louis L'Amour. Knowledge is like money. To be of value, it must circulate. And in circulating, it can increase in quantity and hopefully in value. So very true, right? This quote reminds us that knowledge is continually shared. Knowledge in quantity increases its value, its worth, the quality of its output. This quote encourages us that our knowledge gained is valuable. We must put in the quantity work, the dedicated focus work of actually learning, by reading, by listening, by looking, by doing. What's delivered then is quality, the knowledge we've gained. I'm happy Louis L'Amour's spark still burns brightly in all of us today. So that wraps up today's episode, and as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, all right, you guys, remember the new year is for your renewed hope, all of your new chances that are around the corner. It's a time to start something fresh or revisit that project that you started with a new outlook. Now, as I'm recording this episode, the snow is falling outside my window and I'm simply mesmerized. I'm surprised I even got through this entire episode because it's been snowing consistently this entire time. And I'm so happy it's the first major snowfall here. And I've definitely gone off script on this podcast right now because now I'm just going to talk about the falling snow. It is so soft. The sound effects that are picking up on my microphone are non-existent because when it snows, it's just that blanket of quiet. So you guys have heard no cars that have gone by, no trucks, the mailman, the UPS, nothing. You guys can normally, if you really, really hone in and listen, you can hear some of the background noise on past episodes because my microphone is so powerful. But today's episode, you'll hear nothing because everything is cushioned in this blanket of falling snow. It is completely magical. I wish you guys were seeing it. I wish I put this on video, but it's not on video today. My video episode is going to be airing on Friday for Compliance Capers, and it wasn't snowing then when I recorded that episode to video. But maybe this week when I record again, the next video sessions, it'll still be snowing. It is just breathtaking. I hope somewhere in the world, wherever you are, you have a chance to witness some beautiful, beautiful falling snow at some point in this winter season because it is simply magical. I'm going to go outside, get bundled up, put on some snazzy scarves and hats and boots, and take a walk. I'm going to go and decompress, take my own advice that I give to all of you week after week to carve out that special time just for yourselves where you can decompress and get rid of any stress that you've been building up during the work week. So wish you guys all an amazing, amazing, incredible week ahead. And again, don't forget to tune in to my LinkedIn Live session on Friday morning at 10 for my new segment called Compliance Capers with my good friend, Betty Hovey. It's also going to be available on my YouTube channel for Paint the Medical Picture. So you can tune in to both places on Friday. Anyways, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.